Up to 80% of all men and around 40% of women will struggle with hair loss at some point in their lives. And their first gray hairs? Many discover them between the ages of 30 and 50. These figures show hair is more than just a cosmetic detail. It influences our self-image, our well-being, even our psyche. The desire to halt or even reverse these processes is by no means new. Already in ancient Egypt, over 3.5 millennia ago, people sought remedies for hair loss. But what if today, with the latest scientific advancements, this process could be halted or even reversed? Today we dive deep into the science behind hair loss and graying. What are the causes? Which promising treatment methods truly exist? And what does current research say? To understand what actually happens with hair loss, we first need to take a closer look at the natural hair cycle. Every single hair on our head goes through a repeating cycle of growth, transition, and rest, much like the seasons in nature. There are essentially 3 main phases plus a shedding phase. First, there's the Anagen phase, the active growth phase. This phase is by far the longest and for scalp hair can last an impressive 2 to 6, sometimes even up to 8 years. During this time, hair is continuously formed in the hair root, the follicle, growing on average about 1 to 1.5 centimeters, approximately 0.4 to 0.6 inches per month. Approximately 80 to 90% of our scalp hairs are normally in this productive phase. Next comes the Catagen phase, a short transition phase of only about 1 to 2 weeks. During this time, the hair root detaches from its nutrient supply. The hair follicle shrinks to about 1/6 of its normal size, and cell division, that is, hair production, comes to a halt. The hair, so to speak, prepares for its end. Only about 1% of hairs are in this phase at any given time. Subsequently, the hair enters the telogen phase, the resting phase. This lasts approximately 2 to 4 months. The hair is now completely detached from the follicle, but remains in the scalp while a new hair follicle beneath it regenerates and a new hair begins to grow. This new hair slowly pushes the old, resting hair upwards. Around 10 to 20% of our hairs are in this phase. Finally, there's the exogen phase, the actual shedding of the old hair. This often happens unnoticed during combing or washing and makes way for the new hair growing from the new anagen phase. A daily loss of 30 to even 150 hairs is therefore part of this completely normal renewal process. It only becomes critical when this finely tuned balance is disturbed. For example, if the anagen phase is shortened, many hairs prematurely enter the telogen phase, or the follicles themselves are damaged. Then, medical professionals speak of pathological hair loss known as alopecia. The causes for this are incredibly diverse. The most common form is androgenetic alopecia, or hereditary hair loss. Up to 80% of men and 40% of women are affected. Here, genetically predisposed hair follicles react with hypersensitivity to dihydrotestosterone, or DHT, a breakdown product of the male sex hormone testosterone. The role of androgens in hair loss was already extensively studied in the 20th century, and the understanding of DHT as a key factor has solidified since then. DHT binds to receptors in the hair follicles, leading to a shortening of the anagen phase and progressive miniaturization of the follicles until they eventually wither. In men, this often manifests as a receding hairline and a thinning crown, leading to baldness. Interestingly, the hair around the back and sides often remains, as these follicles are DHT resistant. Women typically notice diffuse thinning, especially in the part line. Hormonal changes, such as after pregnancy or during menopause, can accelerate the process. Then there's telogen effluvium. This is often temporary hair loss that typically begins 1 to 3 months after a significant physical or emotional stress event. Triggers can include surgeries, severe infections, significant weight loss, nutrient deficiencies, especially iron, zinc, biotin, or vitamin D, or certain medications. In this condition, an above-average number of hairs prematurely switch from the Anagen to the Telogen phase and then shed excessively, sometimes up to 300 hairs per day. The good news, once the triggering factor has been identified and eliminated, hair growth largely recovers completely. Not to be forgotten is alopecia areata, or patchy hair loss. This is an autoimmune disease where the body's own immune system mistakenly recognizes and attacks the hair follicles as foreign. This leads to sudden, round, bald patches, predominantly on the scalp. In more severe cases, eyebrows, eyelashes, or even all body hair can be affected. The exact causes are complex, with genetic predisposition and possibly psychological stress playing a role. Hair growth is, in principle, reversible, as the hair follicles are not permanently destroyed. Diagnosis plays a crucial role. A dermatologist will take a detailed medical history, thoroughly examine the scalp, and possibly perform a pull test or trichoscopy, a microscopic analysis of the hairs. Blood tests can help uncover deficiencies or hormonal imbalances. In some cases, even a small scalp biopsy may be necessary. Especially with androgenetic alopecia, early diagnosis is of great importance to slow down the progression of the condition. Let's move on to treatment options. Among medications, Minoxidil is a classic. Originally, and this is an interesting historical footnote in medical history, it was developed in the 1970s as an oral medication for treating high blood pressure. However, an unexpected side effect in some patients was increased hair growth. This led to the development of a topical minoxidil solution for direct application to the scalp. Today, as a solution or foam, it widens blood vessels in the scalp, improves blood circulation and nutrient supply to the hair follicles, and stimulates the formation of growth factors, thereby shortening the resting phase of hairs and prolonging the growth phase. It's available over the counter, typically as a 2% solution for women and a 5% solution for men. First results are often seen after 3 to 6 months. Important to know, at the beginning, a so-called shedding effect can occur, a temporary increase in hair loss. However, this is often a sign that the treatment is working, and application usually needs to be lifelong. For men with hereditary hair loss, there's Finasteride, a prescription medication approved for this indication in the 1990s. It specifically inhibits the enzyme 5-alpha reductase type 2, which converts testosterone into the more harmful DHT for hair follicles. By lowering DHT levels, the miniaturization of hair follicles is slowed or stopped, which reduces hair loss, and in some cases can even stimulate new hair growth. Here too, the effect only lasts while taking the medication. Rare side effects can affect sexual function. Pregnant women must under no circumstances come into contact with it. Dutasteride works even more powerfully as it inhibits both types of the 5-alpha reductase enzyme. But its official approval for hair loss varies by region, and it is often used off-label, sometimes as an injection into the scalp. A significant breakthrough in the treatment of alopecia areata are the so-called JAK inhibitors, such as baricitinib or ritlecitinib. These newer medications, whose development is based on a deeper understanding of the immune processes in this disease, calm the overactive immune system that attacks the hair follicles. In clinical studies, they showed significant hair regrowth in a substantial proportion of patients, sometimes 50% or more, including eyebrows and eyelashes. Baricitinib has already received regulatory approval in major regions, and ritlecitinib is even approved for adolescents aged 12 and above in certain areas. Besides medications, there are also medical procedures. Hair transplantation is considered the gold standard for genetic hair loss when a permanent result is desired. The technique has evolved enormously since the first attempts in the mid-20th century. Previously, Larger skin strips with multiple follicles were often transplanted, which could lead to a less natural appearance. Today, DHT-resistant hair follicles, usually from the back of the head, are individually extracted using minimally invasive methods like FUE, follicular unit extraction, or DHI, direct hair implantation, and precisely transplanted to bald areas. The costs? For 3,000 hairs, you can expect prices to range from a few thousand to several $1,000s or more, depending on the clinic and region. For 5,000 hairs, it can be a substantial investment. Another option is PRP therapy, platelet-rich plasma. The patient's own blood is processed to obtain plasma rich in the body's natural growth factors. This is injected into the scalp to promote cell regeneration and blood circulation in the hair follicles and prolong the growth phase. Often, 3 to 5 sessions are needed, with costs per session ranging from hundreds to several $100s. Regenerative therapies that utilize the body's own follicular stem cells are also on the rise. And what can you do yourself? A balanced diet is fundamental. Proteins, iron, zinc, biotin, and vitamin D are key nutrients. Nutritional supplements can support in cases of deficiency. Stress management is equally important. Chronic stress is poison for hair. Sufficient sleep, gentle hair care, and avoiding nicotine and alcohol also contribute to hair health. Some home remedies like rosemary oil even show effectiveness similar to minoxidil in studies by potentially inhibiting DHT binding. Now to the second big topic, hair graying. The color of our hair comes from the pigment melanin, produced by special cells called melanocytes, which are located in the hair follicles. Even in antiquity, people puzzled over the causes of graying, but only modern science has been able to clarify the mechanisms. With increasing age, and this process is strongly genetically predetermined, the function of melanocytes declines. They produce less melanin and eventually die off. The hairs then store less pigment and grow back colorless or white. The visible gray is actually an optical illusion created by the mixture of still pigmented and already depigmented hairs, which are white. The main cause for the timing of graying is genetics. It usually starts between the ages of 30 and 50. Oxidative stress from free radicals, for example from UV radiation or environmental toxins, can additionally damage the melanocytes. And yes, psychological stress is also a factor. A widely recognized study from 2021 has shown that stress-induced graying can indeed be reversible when the stress subsides, at least in younger individuals whose melanocyte stem cells are still activatable. For age and genetically induced graying, where melanocytes have permanently ceased their function, this unfortunately usually doesn't apply. What helps preventively? Stress reduction, a healthy diet, and avoiding smoking. Certain nutrients are also interesting here. The enzyme Catalase breaks down hydrogen peroxide, which can accumulate in the hair follicles and contribute to graying. Copper is important for normal hair pigmentation. Vitamin B12 and the amino acid L-tyrosine are building blocks for melanin formation. Products combining such active ingredients are available. Cosmetic solutions like dyeing or silver shampoos, of course, always remain an option. Let's now take a look into the future, because research is not standing still. Stem cell research holds enormous potential to regenerate inactive or damaged hair follicles and induce new hair growth. The gene editing tool CRISPR-Cas9, a revolutionary discovery of recent years, could one day make it possible to directly correct genetic causes of hair loss or make hair follicles more resistant to DHT. Although many studies and the clarification of ethical questions are still necessary here. New active ingredients, such as the SCUB3 protein, which is supposed to reactivate stem cells on the scalp, or polynucleotides for tissue regeneration, are currently under investigation. Leading research centers and institutions worldwide play an important role in global hair research. So, what are your key takeaways? Hair loss and graying are complex processes with a long history of human efforts to understand and influence them. An accurate diagnosis by a specialist is the first and most important step. While temporary hair loss or stress-induced graying are often reversible, it is more challenging for genetic and age-related forms. Here, the primary focus is on management, slowing the process, and improving hair health. A combination of modern medical therapies, a nutrient-rich diet, and a healthy lifestyle promises the best results. Research continues to make progress and offers hope for even more effective treatments in the future. But a universal overnight miracle cure, despite millennia of searching, does not yet exist. We hope you enjoyed this episode. We would greatly appreciate a thumbs up and a subscription. As always, we wish you all a long, healthy, and happy life. Until next time.